On the line with us right now, we have someone who can educate us on the pros or maybe the cons of getting the vaccine to your child as young as 6 months old. Joining us right now, we have Dr. Michael Bigham from Akron Children's. Doctor, how are you?
I'm great. Thanks for having me.
Yes, thank you. So, if you don't mind, just about how many vaccines has Akron Children's Hospital administered?
We have given over 80,000 vaccines since the pandemic started. That's about 2% of all of the vaccines given in the state of Ohio.
Well, that's great that you've given so many. And are people lining up for it, or are you pretty much giving it to? Are you pretty much giving it just to people who are already in the hospital that you're offering it to them?
So we continue to have a steady and ongoing demand for the vaccine. As an example, in the month of January, we still gave 5,000 vaccines for the month of January, and about 3/4 of those are kids 5 to 11 years of age, and about 1/4 of those are kids 12 and older, some of which were booster vaccines for those 12 and older, and some were first or second doses.
So I'm curious, what are some of maybe the pros, what are maybe some of the cons of vaccinating a child such as 6 months old?
Yeah, so I think that we're all a little bit unsure about what the data are going to tell for the kids 6 months to 5 years of age. And so what we know is that Pfizer has submitted their data to the FDA. The prediction is that about a week from today, on February 15th, the FDA is going to review the Pfizer request for emergency use authorization, and the dose and data, the dose that informed the data that they're presenting are a smaller dose. So basically, the adult dose was 30 micrograms. The younger child dose was 10 micrograms, and the dose that they submitted for the youngest of kids was only 3 micrograms. And they recommended 2 doses of that in this emergency use authorization, is what we understand. We won't know the full details of that study until the FDA has reviewed it and they release the data. So everything I've mentioned and everything I might offer will be a bit speculative until we see sort of the benefit of that vaccine on the youngest of kids.
Yeah, and I've had people texting right now. They're like, honestly, I have people that are texting me, and they're like, honestly, I don't know if I want to get my child vaccinated. I'm vaccinated, but I don't know if I feel comfortable giving it. But you can reassure that if this vaccine does come out, which it is likely that it will at some point, that it'll be a much smaller dose. What we're getting a shot of isn't going to be the same shot that a 8-month-old child's going to get, right?
That's correct. That's correct. It's the older child dose is about 1/3 of the adult dose, and this youngest child dose is about 1/10 of the adult dose. And so there's certainly a lower dose. But I think the questions that you're getting text about are the same questions that we're obligated to answer, right, and answer honestly. And so I think folks should all ask those questions, and it's our job as healthcare providers to answer those questions. I think we need to see what these data say, and then we can give a really more informed answer. I think it's not helpful to sort of line item say everybody has to get vaccinated or nobody should get vaccinated until we see the data. There might be nuances within those data that suggest there are higher or lower risk kids within that age population, and I think that's probably the most important piece, is that we're open and honest with parents as they're making this decision for their child.
Even when it comes to adults, doctor, how important would you say having the vaccine is?
Yeah, so I think what we know, and I'll first give the Akron Children's example, and then I'll speak a little more broadly to adults. If we look at the subset of patients who have been admitted to the hospital who have tested positive for COVID-19, 93% of those kids admitted to Akron Children's who've tested positive for COVID-19 from January 1st of last year until a week ago have been unvaccinated. So that's 8% have been vaccinated. Of those 8% that are vaccinated and admitted to the hospital, half of them had only one dose or were not far out from their second dose, so I would consider them partially vaccinated. So now we get down to only 4% of our admitted patients who tested positive for COVID-19 have been vaccinated, and of that, half of them are beyond their booster dose, and the other half are immune suppressed in some way, so their vaccine likely didn't take a big benefit. And so we are still seeing amongst those kids that are hospitalized with COVID-19 some demonstration that the vaccine remains protective for kids who are, if we're trying to keep kids out of the hospital with COVID-19.
Okay. So, yeah, I just wanted to see if you're firsthand, which I assume you are because you are a medical professional, firsthand seeing the benefits of the vaccine.
We are, and then if you look, if you just read the literature and listen to our adult counterparts, they are still seeing the overwhelming majority of their inpatient population who's sick with COVID-19 are those that are unvaccinated or immunosuppressed for some other reason.
Okay, all right, and so we're seeing from 5 to 11 right now. That is an age group that within the last 3 months became eligible for the vaccine. Do you see backlash from parents? Do parents just randomly start talking to doctors about why they aren't for the vaccine, and then do your doctors kind of lay out the facts and then make them form their own decision? Or do most of the people that receive the vaccine, are they already for it?
Yeah, so that's a great question. I would say that you heard me mention we, in the month of January, gave almost 5,000 vaccines in our primary care offices. And that, for me, is pretty compelling, that those are the medical home for these kids. And so these are where these kids and their parents are going. They're meeting with their pediatrician. And I think some people come in with a decision that's already been made, either to get a vaccine or not to get a vaccine. But I think others come in with maybe a sense that they might get the vaccine or a sense that they might not, but they really want to go to their healthcare professional where they have a trusting relationship and understand the pros and cons. And we think that's a fine approach, right? I think informed decisions are really valuable. And so we think our pediatricians are more often than not able to have a trusting and honest conversation with those families. And we think many of them do decide to get their child vaccinated based on that honest, informed discussion. There's a lot of misinformation out there in the media, and I think that one-on-one or one-on-two conversation with a family and a patient and a parent and a healthcare provider adds a lot of truth to what might be otherwise misinformation out there.
So you're saying the best way, doctor, to get correct information and form a informed decision is to talk to your doctor and not get it on Facebook. I just want to make sure I'm clear of that.
I think that there is a real value in talking with the pediatrician or your healthcare provider to have that honest conversation for sure.
All right. Well, that's great to know. It's great to hear it from you. So, anything else that we should know regarding any COVID numbers, or are there any new symptoms within children, or is everything pretty much staying the same? We're not seeing many changes with COVID-19 symptoms. What they've been for the last year now are still the same in 2022.
Yeah, I think that's true. We're seeing last few weeks we've seen a bit of decline in pediatric COVID cases that are testing positive. That's really reassuring. We're still seeing some of those post-COVID MIS-C cases in the hospital. We expect those will go down as the COVID cases go down. And I think we're excited to review that vaccine details on those kids 6 months to 5 years of age, and we'll be excited to have a conversation when those data come out and make that available to our patients if that's what the FDA recommends.
All right, Dr. Michael Bigham, I appreciate you coming on and working on the front line to making sure that our children stay healthy, and you and your team informing parents along the way. It's such a big task. Thank you so much for everything you do.
Thank you. I appreciate it. Have a wonderful day.